In 2009 in the US, there was a call by the National Institutes of Health for men who have sex with men as well as transgender females who have sex with men to register for an HIV vaccine trial. They had to be circumcised and with no antibody to the vector of the vaccine, adenovirus type 5, which causes colds. They also had to be between the ages of 18 and 50 with no AIDS-causing virus in their blood, HIV. 26-year-old Matthew Rose fitted this profile and he registered.
I've been in it for about a little over 2 years. It's a 4-shot regimen. You get a shot when you enroll, you get a shot a month later, a shot a month after that, then you wait 3 more months and you get a boost.
He is now one of the needed 2,200 volunteers in an HIV vaccine trial going on in the US that may turn out with a vaccine against the most stubborn virus that many scientists admit does not want to get caught. There are 2 types of HIV, 1 and 2, with HIV-1 being the most infectious.
The subtypes in Uganda are subtype A, subtype D, and then the least common right now is subtype C.
For long, due to the nature of the virus that causes AIDS, it has been hard to find a vaccine against all strains or subtypes within countries.
The problem, or the biggest challenge with HIV, is HIV infection does not induce immunity that protects. The body makes an immune response, but that immune response is not enough to protect from subsequent infection. So you can be infected over and over and over again. So we have to be smarter than nature.
The trial Matthew is involved in is the Hvtn 505 testing, a combination of 2 experimental vaccines, DNA and a recombinant adenoviral vector virus, or RAD5. This study, which aims at finding out whether the vaccine can reduce the risk of HIV infection or even reduce the viral load in participants who later get infected, is being conducted by the HIV Vaccine Trials Network, Hvtn, funded by the US's National Institute of Allergy and Infectious Diseases. Hvtn 505 was shaped by the near success story of a vaccine tested in Thailand by the US military HIV research program known as RV-144 on 16,000 participants. The only first signal for an effective vaccine at 31% done in Thailand was not, however, received with such great news among some scientists.
The RV-144 trial was the best candidate, showed the best safety, showed the best immunity at that time, and it went forward, and now it's efficacious. So everything now has to be at the standard of that. You see what I'm saying? So that's where the controversy lies.
Taking on the follow-up of the RV-144 is a group known as P5, or the POX Protein Public-Private Partnership, including the U.S. National Institute for Allergy and Infectious Disease, the Bill and Melinda Gates Foundation, the HIV Vaccine Trials Network, the U.S. Military HIV Research Program, Sanofi Pasteur, and Novartis.
With future testing of vaccines in Thailand, largely designed to extend the result of the original RV-144 Thai Phase 3 finding.
For countries such as Kenya and Uganda and most all over the world, the best vested hopes are in the US study of Hvtn 505. Vaccines are a saving card in the face of any epidemic.
They prevent infection completely. They would arm the immune system in the infected individual to suppress the virus. So they would be less infectious to others, and they would live longer, healthier lives without drugs.
No vaccine is licensed so far for HIV. Well, during the AIDS Vaccine Conference 2012 organized by the Global HIV Vaccine Enterprise in Boston, the time to find a universal vaccine is right around the corner, according to the enterprise's director, Bill Snow.
Because it's not sustainable to use drugs to keep it under control.
The global conference under its theme New Minds, New Ideas, New Approaches brought in over 1,000 scientists who are working to see to it that a vaccine against the constant changing human immunodeficiency virus is found. Now, as the study in which Matthew is enrolled draws to a final phase here in America, there could be a glimmer of hope for the whole world, as it includes almost all subtypes of HIV, which made AIDS a dangerous epidemic, especially for Africa. For NTV, I'm Florence Nalimba in Boston, USA.